Welcome. Today, we're diving into a medical mystery that is, quite frankly, absolutely terrifying. It's a story about an invisible hazard, the boundaries of science, and a world-renowned expert who made the ultimate sacrifice, leaving us with a legacy that literally changed lab safety forever. We're going to look closely at the tragic case of Dr. Karen Wetterhahn and trace the exact horrifying sequence of events that unfolded after what seemed like a minor, everyday accident in her laboratory.
Okay, let's dive into this. The entire inciting incident of this tragedy, the whole shebang, comes down to just one tiny number. 2. We're talking about 2 tiny invisible drops of liquid.
Just 2 drops ended the life of Dr. Wetterhahn. She was a brilliant 48-year-old chemistry professor with an incredibly influential career at a prestigious institution. And get this, her specific area of research was actually toxic metal exposure. There were very few people on the planet, maybe literally no one else, who understood this subject better than she did. Yet, in this incredibly heartbreaking irony, she ended up falling victim to the exact same thing she dedicated her entire life to studying.
Section 1. 2 drops on a glove. To really wrap our heads around how this exposure happened, we need to set the scene right in her lab. The way this poison progresses is just incredibly deceptive. On day 0, she's in the lab transferring a liquid called dimethylmercury. 2 drops slip from the tip of her pipette and land right on the back of her gloved hand. Now, she did exactly what she was supposed to do, following protocol perfectly to clean it up. She felt totally secure, assuming the chemical never even touched her actual skin, so she didn't give it a second thought. But weeks later, she starts bumping into walls. She nearly gets into a car accident. Initially, she just brushes it off as a bad night of sleep. It wasn't until 5 whole months later that she finally went to the emergency room. By then, she'd lost 15 pounds and was dealing with severe abdominal discomfort.
Section 2. The delayed neurologic decline. When she first got to the hospital, just looking at her skin deep, she actually appeared pretty healthy. But we needed to code her really alarming physical symptoms.
The doctors immediately noticed she was exhibiting upper extremity dysmetria. If we break down the medical jargon here, dys means wrong and metria means length. So the movements in her arms and upper body had become frighteningly uncoordinated. Whenever she tried to reach for something or just position her hands, she would miss the target entirely at completely varying lengths.
Now, what's really interesting here is how the etymology gives us this crystal clear picture of what she was going through. She also had an ataxic gait, a meaning without and taxic meaning order. So her walk was awkward, imbalanced, just completely disorderly. And when you combine that with slurred speech and handwriting she could barely control, well, all signs were pointing to some kind of severe neurodegeneration.
As the days dragged on in the hospital, this sensory deprivation escalated in just a horrifying way. She started reporting tingling in her fingers, these sudden, bright flashes of light, and a constant white background noise that was literally washing away her normal hearing. Even her field of vision was narrowing down. Finally, a blood test revealed the culprit, and it was staggering. Her blood mercury levels were over 4,000 micrograms per liter. Guys, that is 4,000 times greater than the upper limit of normal. The absolute most terrifying part? She hadn't even been in a lab for months. This acute, massive toxicity came entirely from that one single isolated spill on her glove.
Section 3. A fat-soluble poison. We really have to look at the specific biochemistry that makes dimethylmercury so unbelievably lethal and deceptive. I want to pose a critical puzzle to you. Based on her weight of 70 kilograms, doctors estimated she had about 4.5 liters of blood circulating. That meant there were roughly 18 milligrams of mercury in her bloodstream. But studies show that for dimethylmercury specifically, only 5% of the absorbed amount actually stays in the blood. So, where in the world is the other 95%? The answer all comes down to this crucial definition: lipophilic. You see, elemental mercury is a metal, right? But dimethylmercury is an organic mercury. That dimethyl part makes it highly lipophilic. Lipo meaning fat, and philic meaning an affinity for or loving. So instead of staying in the watery environment of the blood, this particular poison preferentially hides away, sinking deep and mixing right into the body's fat tissues. And this brilliantly illustrates a truly horrific reality. If that 18 milligrams in her blood was just the 5% tip of the iceberg, that meant a massive 360 milligrams of mercury had actually accumulated deep within her body over those 5 months. To put that into perspective, the generally accepted lethal dose is around 400 milligrams. She was in profound trouble. So, you might be wondering, which fat tissues was the mercury attacking? Well, it wasn't her heart or her kidneys. It was her brain. The human brain is essentially 60% fat. On top of that, the myelin sheaths, those protective coverings over your nerve axons that feed stimuli to your brain, they're also about 60% fat. The organic mercury was setting up shop directly inside her nervous system, causing massive oxidative stress, tangling up proteins, and basically inducing mass cell death.
Which brings us to section 4, why chelation therapy failed.
Her doctors were absolutely desperate to pull this poison out of her fat tissues. Normally, your body removes chemicals by making them water-soluble, so your kidneys can just flush them out. But inside the liver, dimethylmercury simply breaks down into methylmercury, which, unfortunately, is still lipophilic. So they tried chelation therapy. They gave her a molecule called succimer, which essentially acts like a claw to trap the organic mercury inside itself. The outer layer of that succimer molecule mixes nicely with water, allowing the kidneys to excrete the whole package. And honestly, it seemed like it was working. Her urine mercury level shot up 160 times. But tragically, just 3 weeks after arriving at the ER, Dr. Wetterhand slipped into a coma.
Here is the absolutely crucial and really tragic point of this whole story. Removing mercury from the blood is not the same thing as healing the patient. I mean, less mercury in the blood seems like a win, right? But chasing a lower number on a lab test doesn't necessarily mean the patient is recovering. She was completely unresponsive at this point, experiencing unprovoked eye openings, spontaneous yawning, and sudden jerky movements in her limbs. She was essentially trapped in a prison of her own comatose body. Because the tragic reality was this: removing it from her blood wasn't removing it from her organs. The toxin was already deeply embedded into her neurologic tissue. The mercury had caused extensive neuronal loss and gliosis, which is basically this inappropriate, wild overgrowth of nerve-supporting cells all throughout her cerebellum and her visual and auditory cortices. The damage, sadly, was completely irreversible.
Section 5. A lasting scientific legacy.
Let's see how this builds, because after she slipped away, investigators had to reconstruct the accident to figure out exactly how this happened, and in doing so, they changed science forever. By testing her hair in tiny 2mm increments, they found out that the amount of free mercury halved every 75 days. Working backward, the maximum excretion they recorded was roughly 150 days before she went to the ER. That perfectly matched the 5-month timeline she gave the admitting nurse. But doing the math on this revealed an even more shocking truth. Her initial exposure wasn't 360 milligrams, it was actually 4 times that amount, roughly 1,440 milligrams.
To really help you grasp the mind-boggling scale of that exposure, I want you to consider this number: 144,000 pounds.
If you wanted to naturally reach the same level of mercury exposure that Dr. Wetterhand suffered, you would literally have to sit down and eat 144,000 pounds of fresh Atlantic salmon. And yet, because dimethylmercury is 3 times more dense than water, that exact same lethal dosage was contained within just 2 to 3 tiny drops of liquid. Investigators found out after the fact that dimethylmercury diffuses straight through the standard latex gloves she was wearing that day in a matter of seconds. Literally seconds. Now, because Dr. Wetterhand was a world-renowned expert, she knew exactly what her diagnosis meant. She knew her fate. But incredibly, she used the delayed onset of her symptoms to issue advanced directives. She deliberately notified the scientific community of her story, to warn them. Today, thanks to her, anyone handling dimethylmercury has to follow strictly enforced modern protocols. We're talking highly resistant laminate gloves worn underneath a pair of long-cuffed neoprene or nitrile gloves. Her family, her colleagues, and the government worked together to create an extreme global awareness of laboratory safety.
So we'll close today's explainer with a thought-provoking question for you. If 2 invisible drops on a seemingly safe glove could silently bypass our defenses, embed themselves into the body, and cause delayed onset cerebral disease months later, what other everyday occupational hazards are we still totally overlooking? It's a stark reminder to always be hyper-cognizant of what comes into contact with our skin, and a powerful testament to a brilliant scientist whose story transcends time. Thanks so much for learning with us today.